Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. We have now administered more than 107,400 doses of the COVID-19 vaccine, and more than 17,000 Albertans have now been fully immunized with 2 doses. Over the last 24 hours, we have identified 268 new cases of COVID-19 and completed about 7,900 tests. Our positivity rate currently stands at about 3.5%. Looking to schools, there are currently active alerts or outbreaks in 305 schools, or about 16% of schools in the province. These schools have a combined total of 726 cases. Currently, there are 556 people in hospital, including 97 admitted to the ICU. Unfortunately, 13 new deaths were reported to Alberta Health in the last 24 hours. These are 13 people between the ages of 27 and 93 whose loss leaves a hole in the lives of those who cared about them. This is a challenging time, and my thoughts are with anyone who is grieving the death of a family member, friend, or colleague. Thankfully, our cases, deaths, and hospitalizations are continuing to trend down. This is encouraging, but at the same time, we must remain vigilant. In particular, we are actively monitoring for cases of the variants of concern first identified in the UK and South Africa, as well as all other emerging strains. These variants are new, but the public health response is not. We actively conduct contact tracing to ensure that anyone at risk of exposure to these variants is isolated and tested. In cases involving variants, we are being extra cautious to reduce the chance of infection spreading widely into the community. Alberta Health Services has formed a dedicated variant contact tracing team with experienced investigators to ensure that a prompt and enhanced investigation happens each time a variant of concern is identified. As I mentioned yesterday, our lab has enhanced their capacity to be able to screen 300 samples a day for these variants and to run full genetic sequencing on 400 samples a week. They are also continuing to work to expand this capacity. And in the meantime, the lower our overall case count, the greater the proportion of positive tests we are able to screen. As of this morning, we have found a total of 50 cases of the variant identified first in the UK, and 7 cases of the variant first identified in South Africa, bringing us to a total of 57 variants of concern. The vast majority of these cases, all 7 of the variants first identified in South Africa, and 36 of the cases of variants first identified in the UK, are in returning travelers. An additional 6 cases have been detected in close contacts of returning travelers. However, 8 of the 57 cases that we've detected in 5 different households have no links to travel yet identified. This is an increase of 2 from yesterday. Investigations are underway to determine the source of these cases, but at the moment, what we have identified is a link between 4 of these cases to a daycare outbreak. This link was just identified today, and work is underway to notify parents and staff of this facility that the outbreak at this location may be at least partially caused by a variant strain. This is concerning, but it does mean that we have a better chance of controlling spread when we understand the linkages between cases. In addition, as I mentioned earlier, as part of our public health investigations, in cases in returning travelers, we have identified some spread of COVID within those households. In 2 Calgary zone schools, this household spread has unfortunately led to children of returning travelers attending school while those students were determined to have been infectious. 3 classes from 2 schools are now isolating as a result. It is important to remember that cases are assessed as infectious in the 2 days before their symptom onset, or 2 days before a positive test if they did not have symptoms. The families involved in these situations did not intentionally break any rules and should not be blamed or shamed. With these school exposures, the affected class and any staff who have been involved with the potentially infectious student case were already being treated as close contacts when the original student's COVID test came back positive. This means they had already been asked to quarantine when the COVID diagnosis was first made in the student. Once the samples subsequently tested positive for a variant of concern, healthcare teams began contacting all those who may have been potentially exposed. The importance of strict quarantine is being emphasized in these phone calls, and these contacts are being asked to be tested twice for COVID-19 to reduce any potential for further onward transmission. We are analyzing these cases and emerging evidence closely. There is no evidence right now that there has been any spread of the variant at these schools. One of the themes we are seeing in Alberta, and one that has been reported in other places, is that it can be more difficult to effectively quarantine or isolate away from other household members with variant strains of COVID. In order to reduce the risk of transmission from household contacts, we are ensuring that any new cases or contacts linked to variants of concern are aware of hotel isolation and quarantine options. If cases choose to stay home during their isolation period, their household contacts will now need to stay at home as well in quarantine until 14 days have passed from the end of the case's isolation period, or a total of 24 days. Given how easily this variant is spreading in homes, this enhancement is necessary to prevent spread in the community. There is a lot of talk about variants right now, and I understand that any new cases can generate anxiety. I know that some people are also feeling information overload as they try to understand what all of this means. The main reason we are concerned about these variants is that they spread more easily from person to person, which is why we must be cautious. These variants spread in the same way as the strain that is currently dominant in Alberta, just more efficiently. They are still spread by being in close contact with an infected person. And the same types of preventive strategies will still be effective when rigorously followed. This includes the measures in place to limit transmission within schools, which remain vital to helping prevent the spread within classrooms. With 57 cases of variants detected, I know that some may be wondering why we have detected so many. This is thanks to both the excellent work of our lab to expand variant testing quickly and to the Border Pilot program, which has detected 28 of our variant cases. Outside of the Border Pilot, individuals who return from traveling internationally are required to quarantine in their homes when they come back into Alberta or anywhere else in Canada, but they would not usually be tested unless they showed COVID symptoms and sought testing out for themselves. This means that typically only a small proportion of returning travelers are tested after arrival. Under the Border Pilot, since November, we have been able to test almost 45,000 returning travelers as soon as they arrived. The positive cases identified from this testing have included many who were not showing any symptoms. We have also been able to retrospectively test all positive cases identified in the Border Pilot for variants of concern, which has resulted in the total case increases that we've seen over the past week from these historical samples. This has been a vital tool as we are working to stop this virus from spreading quickly within our communities. Without this pilot program, our variant case numbers would be lower, but the variants would likely be spreading more widely in our province without us knowing about it. The key to limiting variant transmission is to actively test for them, quarantine anyone who may have been exposed, and break the chains of transmission before they have a chance to spread. We are working hard, but these variants are yet another reminder that we are not out of the woods yet. The potential for rising cases, including the spread of variants, is one of the things we will be watching closely for in the days ahead. New case trends and positivity rates will help determine if we need to pause further actions or potentially increase restrictions in the future. We can all help limit variants by limiting community transmission. That is and always will be crucial to our fight against COVID-19. We are all protecting each other and helping to keep each other safe every day. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First is Eva Ferguson with the Calgary Herald. Go ahead, Eva.
Thank you. I want to ask Dr. Hinshaw, given the rising concerns around the new variants in Alberta and now in schools, and the fact that many countries in Europe are either ensuring students are wearing better masks with 2 cloth layers and a filter, or staying physically distanced at all times, or keeping older students online. My question is whether Alberta Health Services would consider implementing any of these increased safety protocols in schools to ensure the new variants don't multiply exponentially.
We are looking at whether or not there may be any additional protocols needed in schools. As I mentioned earlier, there is no evidence at this time that the variants have spread within schools. We are doing extensive contact tracing and additional testing to ensure that we have the best possible evidence about the outcomes of the exposures that I've just mentioned. And as I said, looking to see what, if any, additions we may need to add to school protocols. But at this moment in time, again, we don't have evidence that that these variants have spread. This is simply an occasion where there have been 3 classes with exposures, and we will know more in the days and weeks ahead.
Operator, could you put through the next caller, please?
Next is Lisa McGregor with Global Edmonton. Go ahead, Lisa.
Hi, Dr. Hinshaw. I was wondering, what is the priority for our province when it comes to rapid testing, when they use it and where they use it, especially considering we're seeing the Prime Minister say that we have so many in stock that has not been used, and which is true considering we've used less than 2% so far of the 1.3 million that we have received. And also places like Suncor have received rapid testing for free from Health Canada, and they're enforcing it. So where's the priority in potentially using it in schools or other places, since we do have it in stock and we're just not using it?
We have been using rapid tests in several places since they began arriving in November. Part of the work that we needed to do in the province was to make sure that we validated the tests to understand how they compared with our typical processes and our PCR testing. And the testing works well when it's used as licensed in individuals who have symptoms where their symptom onset was within the last 7 days. And so those tests are being used right now in places where transportation can be difficult. So in many rural locations, they're being used in some shelter locations, in long-term care outbreaks as mobile rapid testing. And so they have been deployed in many of those settings so that we can more effectively get an answer to whether or not there is a COVID infection close to the point of testing. In addition to that, we have been exploring different options for off-label regular asymptomatic testing, which is that regular screening of people who have no symptoms and no known exposure, in addition to all other public health requirements. One of the concerns is that if people use regular testing as a replacement for public health measures, because these tests are not as good at picking up the virus as PCR tests, and also because any test, no matter how good, is only a snapshot of a moment in time and does not indicate whether or not that person might be incubating the virus, we need to make sure that we're being very thoughtful about what locations we could potentially use these rapid tests in, but we are exploring possibilities. For some of those locations where doing regular tests in those who have no symptoms may be helpful as an addition to other public health measures.
Operator, could you put through the next question, please?
Yes. Next question is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. First, just a quick clarification, hoping you can tell us which zone the daycare is that you mentioned in your remarks. And then my question is, with the cases that we are now seeing of the variants in schools, is it reasonable for the province to stick to this February 8th timeline for reopening, considering how much more contagious these new variants are? Some doctors we've spoken to say with this new variant, Alberta could potentially see a larger third wave if current restrictions are not maintained.
At the moment, we want, as we just learned about the daycare connection today, we want to make sure that we're notifying parents and staff of the affected daycare before we identify which zone that location is in. And so at this time, that's not information that I'll be providing. With respect to the timing of the measures, we of course know that seeing additional cases of the variants without a clear link to travel is concerning. However, the important thing that we are doing is we're looking to see whether or not we are able to meet that February 8th timeline is to continue to monitor our case counts, our positivity rate, and we know that if we continue to follow all public health protocols in every aspect of our daily lives, that we can continue to keep our transmission low. So it really is up to those businesses that are looking to potentially opening on the 8th, as long as we're able to maintain our trajectory, to make sure that they are following all of the requirements and all of the protocols. And we will continually assess the impacts. We have not seen any change in our lowering trajectory of cases and hospitalizations since we opened the schools. We've not seen any change in the lowering trajectory of our cases and hospitalizations since we opened personal services and outdoor social gatherings. And so again, we continue to take very small steps and evaluate constantly to make sure that we are doing so safely. And as well as I mentioned, the steps that we're taking to do everything possible to stop any transmission of variant cases.
Operator, could you put through the next caller, please?
Next is Jesse Weisner with Global Calgary. Go ahead, Jesse.
Hi, Dr. Hinshaw. Just wondering how many of the confirmed cases came from the variant spread within the daycare specifically?
We don't have all of the cases linked to the daycare outbreak tested at this point in time for the variant. So I don't know how many of that particular outbreak, how many cases are from the variant versus perhaps another strain. That's work that we're undertaking right now. And at the moment, we have 4 cases that are linked to that location. And we're working to notify, as I said, all parents and staff and to do additional follow-up to understand, again, how there may have been exposure that led to this outbreak.
Operator, could you put through the next caller, please?
Next is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, Dr. Hinshaw. I want to know if you are still putting aside the theory that there is no transmission in the community, and if you are worried about the new cases that we are seeing in Alberta of the variant.
I think it's clear, as I mentioned yesterday, that there is some transmission in the community that we are starting to pick up. So I think the question about whether or not the transmission is widespread, that does not seem to be the case at this moment, given that we are, as I mentioned, screening 300 samples a day for the variant and have detected only a very small handful. You may recall there are 8 cases that we've detected without a link to travel. 4 of those seem to be linked to the same outbreak. And so those are concerning. I am concerned about the presence of the variant in our communities. At this moment in time, though, it is not the dominant strain, and we are doing everything possible to contain all of those cases and contacts that we have identified.
Operator, could you put through the next caller, please?
Next is Lisa Johnson with Post Media. Go ahead, Lisa.
Hi, thanks for sharing these numbers about the variants of concern, Dr. Hinshaw. I'm wondering if you can give us the total number of COVID-positive samples that have been screened for the UK, or the variants of concern, and what the percentage is for testing positive or coming back positive with these variants.
We'll have to follow up with that. I don't have the total that have been screened over the last month. I know that we have tested every single positive sample that has come in through the Border Pilot program. As I mentioned, there were 28 positive variants within those samples. So 100% of Border Pilot positives, again, have been genetically sequenced. In addition, our regular lab, our public health lab, is doing that additional testing I mentioned, and we'll follow up with them to get some numbers in terms of how many have been sent for full sequencing and how many have been screened with the quicker test that looks specifically for the mutations of concern.
All right, we've got time for 3 more questions. Operator, could you put through the next one, please?
Next is Aaron Collins with CBC National. Go ahead, Aaron.
Thanks for taking my question, Dr. Hinshaw. And this is more of a clarification, I guess, and then followed by a question. You've said there's these variant outbreaks in a daycare as well as a school. Have those definitively been connected to travel? So is the source of that directly tied to some travel? And if so, should people who travel outside of the country and have children be allowed to send their children to school or to daycare when they return?
So to be clear, the daycare outbreak at this time, we do not have a known link to travel. We just learned of the connection today, so we're just moving forward with that investigation, and at this time have no known link to travel. I also want to be clear that there are not outbreaks in schools. What we have are 3 classes that in each of those classes there was 1 child who attended while potentially infectious, and in each of those cases the child was from a household where there was a returning international traveler in that household. And so that's part of the reason that we have changed our protocols so that when we have anyone who's tested positive for a variant of concern, we will no longer assess the ability to stay in a different part of the house as adequate for isolation away from other household contacts, and all household contacts will need to remain in quarantine until 14 days after that individual's isolation period has ended. And in addition, we are looking to see if there's any other measures that we may need to put in place with respect to the variant.
Operator, could you put through the second last question, please?
Camilla DiGiuseppe with CTV Calgary. Go ahead, Camilla.
Thank you. Good afternoon, Dr. Hinshaw. It's keeping with the variants in schools questions. You mentioned again 2 Calgary zone schools have been impacted with students attending while potentially infectious with the COVID variants. Why won't these schools with the COVID variant be identified, even though schools with the regular COVID-19 strain are being named?
So any school that has any case of COVID is identified in an equitable way. So if the school has 2 or more cases in the school, it will be indicated on our school alert and outbreak map online. And so we don't differentiate in that school map which cases may have happened that are variants and which are not. What we are doing is making sure that each parent of a child in the affected class and any affected staff members are individually notified, as they are the ones who are impacted by this potential exposure. But at this point in time, I want to be clear again that there is no known transmission. We are evaluating to see whether or not that may have been the case, but at this point in time, we do not have evidence that there was transmission in these classes, but we are acting out of caution and making sure that we are notifying all of the parents of those other students and notifying staff to be sure that we're doing extra follow-up, extra testing, and double-checking to see if there was any transmission. But at this point in time, there's no evidence that these schools pose any greater or different risk to the public than any other school.
Operator, could you put through the final question, please?
Final question is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, Dr. Hinshaw. Can you explain which countries we're importing the variants from? I know they originate out of the UK and South Africa, but they're sort of all over now. Has Alberta identified the most problematic origins for travelers?
We're seeing variants come from multiple different countries. So I would say it's not just 1 or 2 different countries, but we have identified many countries around the world where people have traveled to and then come back to Alberta and subsequently tested positive. There are many countries, again, that have identified having one or both of there are 3 different variants of concern right now. And so there are many countries that have identified spread of these. So we could potentially provide a list offline. I don't have that memorized, but what I can say is that it's not just 1 or 2 countries. It's many different countries where we are seeing people picking up those variants of concern and then coming back into Alberta.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.